like to introduce Dr. Edward Ross, Scripps Clinic, Carmel Valley, San Diego, California. Dr. Ross will be speaking on Lumecca. Edward Victor Ross, MD, is a dermatologist specializing in laser surgery. He uses a broad array of technologies to reduce red and brown skin lesions, reduce wrinkles and unwanted hair, improve spider veins of the legs, and improve the appearance of scars, including acne scars. His practice also provides a variety of injectables and fillers to relax upper face lines and replace lost volume of the lower face. In addition to his clinical practice, Dr. Ross conducts research on novel approaches to skin rejuvenation. With access to the latest technologies, he is able to conduct research on fractional lasers for acne scars, use of a novel radiofrequency device for stretch mark reduction, and the use of novel intense pulse light for the reduction of red and brown spots on the face, chest, and extremities. He was recognized by the American Society for Laser Medicine and Surgery with the Caroline and William Mark Memorial Award for his lifetime contribution to research. Take it away, Dr. Ross.
Thank you, Kim. So we're going to briefly go over Lumecca, which is a relatively new intense pulse light device made by Inmode. And the device looks like the photograph you have here. So it's somewhat of an all-in-one system. We're going to focus on the intense pulse light portion of the device, which is the handpiece to your right. I'm going to circle that with the laser pointer here. But if you look to your left, there's several components. There's a body-type component. There's a fractional needle component. There's also a low-impact radiofrequency component and a actual hair reduction laser, diode laser, all built into the system. But today, again, we'll focus on the intense pulse light part of the system. And we'll talk about some of the novel specs of that system and why this IPL can outperform several other IPLs on the market. So over the last 15 years, there's been this ongoing debate about intense pulse light versus laser. And basically, the skin doesn't really care what the source of the light is, in the sense that if you're a chromophore in the skin, whether that's pigment or blood, which are the two chromophores we're really talking about now, which are either hemoglobin or melanin, the skin doesn't care if the light is polarized. The skin doesn't care if the light is coherent. What the skin cares about is how much energy there is at a certain wavelength, and that's going to be directly related to the heat of that particular chromophore. So the debate about IPL and laser could go on and on and on, but basically if you have the right laser or the right IPL with the right spectrum, you can achieve very similar responses. So we're going to talk about laser and IPL here, but again, focus on IPL or intense pulse light, which basically is a form of non-collimated, non-chromatic light where you have a xenon flash lamp, which is the same type of flash lamp we actually have in our cameras, but very powerfully delivered through a set of filters to deliver a certain spectrum of light. So over the years, people have found that although intense pulse light, for example, is good for hair removal, it may not be quite as good as laser as far as longevity and durability. But again, I would say that that's largely dependent on these laser parameters and the IPL parameters. I think you can achieve very similar responses with IPL and laser if you're using the right specs and the right parameters. So most intense pulse light devices, in fact, all of them that are built here have different filters. And the filters are almost like a slide in front of a slide projector. Imagine if you had a slide projector and you put a white slide, if you can remember slide projectors, you would have white light, the same slide light that basically came out of the white bulb. But if you put different colors, a green filter or a red filter, you'll get predominantly that color of light. And that's really what we do with most of the filters with most modern intense pulse light devices. We choose a portion of the electromagnetic spectrum, the visible light spectrum, from green light to yellow light to red light to selectively target whatever chromophore we want to. And generally speaking, longer wavelengths will focus on deeper targets and will cause less epidermal damage. And on the other hand, longer pulses will also tend to focus on deeper targets and have less epidermal damage. So if we go to the next slide, we'll see some intense pulse light devices. This happens to be one built, for example, by Cyton. And a lot of different IPLs have different characteristics as far as how you manipulate the different output spectra. In this case, one slides a different filter in front of the lamp to achieve different spectral characteristics. For example, if you look here, there's 420 nanometers, that's a blue light. Then you have 560, which is predominantly yellow light, 590, et cetera, et cetera. And the color on the end of the filter oftentimes is the predominant color when that spectrum is used. Now, it doesn't mean that all of that light is yellow light, because all intense pulse light devices will put out light beyond what the spectrum says. But what this basically says is the great majority of the light will be within this wavelength range, and that's true for all modern IPLs. Here's another type of filter. Again, most IPLs have the same relative design. They have a filter in front of a bright xenon flash lamp. There's another IPL, again, very similar type of configuration. One has a big system here where you have a filter attached to a handpiece. You have to remember, with intense pulse light, the light is in your hand. Basically, when you use a laser, for the most part, not always, the laser is back in the box, and the light source is actually not in your hand. But with most, in fact, all intense pulse light devices, the light source is in your hand. And that's one reason that you have a somewhat large umbilical cord, because you have to have the power supply and the cooling apparatus attached to the box. Here's another IPL. So we have lots of IPLs. In fact, if you look at the intense pulse light market, there are probably greater than 40 just built in America or made in America, or at least sold in America today. And here's just a little display of some of the intense pulse light devices out there. You see the Luminous One, the Cyton BBL, the Quantum, and then finally some other devices over to your left and to your right there. So lots of different devices out there. And again, we'll focus again on the Lumecca device. Now, we'll talk about some other devices specifically. One is the Icon by Cynosure, which used to be Palomar. It's a very nice device. It does have high peak powers for vessels. It has a small spot adapter, but overall it's a larger spot. Strong cooling. It also drives other handpieces such as 1540, and it has a skin tell to promote confidence, a way to look at skin color in real time. And this is the Max G handpiece, which is really the workhorse of that particular device, with most of the light coming out in the green-yellow part of the spectrum. Now, the Lumecca shares many specifications in a sense with some of that Max G handpiece. There are two specific handpieces with the Lumecca system. One is 515, which is the shorter wavelength spectrum, which includes both of the hemoglobin bands. So if one looks at the absorption for light for hemoglobin, there's a band around 540 nanometers of peak, another band around 570 nanometers. So this includes both those bands. So the Lumecca 515 filter and handpiece is ideal for selectively damaging blood vessels. There's also a 580 nanometer filter where the cutoff is so much longer, and that will be better for darker skin and deeper targets. So let's look at some of the features of this handpiece. So it can go up to 1 pulse per second at all energies. The spot is relatively large. It's about 1 by 3 centimeters. The fluence ranges from 10 to about 30 joules per centimeter squared, and it has a high peak power. I want to focus on that high peak power. Many intense pulse light devices have relatively medium to low peak powers. The advantage of a high peak power is it shifts the light spectrum more to the green-yellow, which again is ideal for picking off vessels. Intense pulse light devices I always feel should be measured by their ability to treat vessels, not necessarily just by their ability to treat pigment, because even a poor IPL can treat pigment relatively effectively, but it takes an IPL typically with a lot of peak power and good cooling to achieve vessel reduction, and this one can do that. You have short and long pulse width selections on both the 515 and the 580 system, or the 515 and 580 handpiece. And a different amount of energy is delivered in the short pulse versus the long pulse, depending on the system. Here's what the platform looks like. Very easy to hold, very easy to store, very light and maneuverable across the skin. Here's some of my own patients that I've treated with. Here's a large vessel on the nose of a gentleman. If you look right after, we treated him effectively at about 16 joules per centimeter squared with a 515 filter in short mode with strong cooling. So with strong cooling, the 515 filter, one can achieve reliable vessel reduction on the nose. You will occasionally get purpura with a short pulse, but that purpura sometimes develops into a better result. If you want to completely avoid purpura, you can go to the longer pulse with a slightly higher fluence. Same gentleman on the right side, again using the 515 filter here at about 16 joules per centimeter squared in short mode with strong cooling. And these are the types of results, again, you can achieve. And again, I measure IPL's success or their design success particularly by their ability to treat vessels. Here's a patient who, again, just before you see, she has a little collection of vessels, telangiectasia on the cheek, and right after treatment, she has a very nice clearance of those. Now, she did get some PURPA. Again, to completely avoid PURPA, one can use a longer pulse and a higher fluence. So we used 14 joules here with a short pulse in strong mode, but had we used the long pulse mode, we would have had to use probably about 18 to 20 joules per centimeter squared to achieve the same vessel reduction. Another patient with telangiectasia, she has typical telangiectasia around the cheek, and again, fairly reliable reduction. You look right here on the nose telangiectasia where the red dot is. You see it's completely resolved after treatment. And this was 17 joules per centimeter squared, and this is what the panel looks like. So when you're treating, you have lots of the features are actually displayed on the interface. It's very easy to change settings. This is 17 joules per centimeter squared. The short refers to the pulse mode. The strong refers to strong cooling. And again, you can go at a normal pulse rate as far as repetition or a slow pulse rate. So you can repeat or you cannot repeat by pushing your hand on the handpiece. Now, again, results, there's some telangiectasia here. If I see this young lady's chin, she also had 3 little angiomas on her cheek here, and this is about 2 weeks after treatment. You see there's complete resolution of the small angiomas and the small telangiectasia here. There's also some improvement in the pigment, and this is about 16 to 18 joules in short, strong mode with the 515 nanometer filter. Again, we really concentrate on the 515 filter because, again, it's the best filter or the best handpiece, I believe, for treating vessels. You have a very high peak power, and the spectrum is shifted where the light output completely is almost configures with the absorption spectrum of blood. Now, pigment is another issue that we look at. And this is a young Hispanic patient, but not a very dark-skinned Hispanic. And she has very challenging lesions because these are somewhat what I call low-contrast lesions. They're not much darker than her skin. And whenever we run into this conundrum, it's a challenge because we have to choose very special settings that will damage the epidermal pigmented lesion or the excess pigment and spare the good guy, which is the background skin. And we're able to do that very well with this system. This is after one treatment, about 4 weeks after treatment. You see that many of the pigmented lesions have improved approximately 70 to 80%. This is strong cooling, short pulse, 515 nanometer filter or handpiece at 14 to 16 joules per centimeter squared. It's always nice to do a little test spot and wait about 5 or 10 minutes just to make sure you're in the right ballpark as far as skin color and appropriate response. And what you're looking for is a little darkening of the hyperpigmented lesion, a little perilesional erythema. That's what you see in the immediate first 10 to 20 minutes. And then longer in the week, you'll see these coffee ground-like crusts. Of course, you may not see those unless you see the patient every day, and you certainly don't need to do that. We normally use a little numbing cream with our patients. You don't have to. You can do it without numbing cream. It really depends on the patient's individual pain tolerance. This is the other side of that same patient. You see significant improvement around the cheeks in the pigmentation of her lesions. This, again, type 3 to 4 skin using 14 to 16 joules per centimeter squared with the Lumecca device. So very reliable device, very easy to maneuver, very light to use, and successful results as long as you use the right settings. That's the key thing, is honing on the right settings. Now, what is special about Lumecca? Because I noted earlier there are lots of intense pulse light devices out there. In fact, you'll be going to the AED meeting soon or maybe some other aesthetic meeting, and you'll see lots of intense pulse light devices on the exhibitor's floor. So what makes Lumecca a nice IPL? Well, it has a large spot size, 1 by 3 centimeters or 3 centimeters squared. The spectrum is versatile because they only have 2 handpieces, but those handpiece spectral cutoff filters are ideal because if you're only going to pick 2, these would be the 2 you pick. It makes it very simple just to switch from one to the other. And it has laser-like parameters. One of the problems, as I noted earlier, with many intense pulse light devices is a lack of a high peak power. When you don't have high peak power, the spectrum wastes a lot of energy. A lot of energy is wasted with longer wavelengths that basically just heat the skin indiscriminately. With a high peak power intense pulse light with proper filtering, you can get, as this device does, about 3 joules per centimeter squared per millisecond. So these pulse boosts are very short. And this is the range of the KTP pulse dye range as far as the amount of energy we're getting out, effective energy per unit time. You have a high pulse repetition rate with a large spot, which means you have a high coverage rate. So when you want to mow a golf course, you want a big lawnmower. You don't want a small lawnmower running very slow. So this offers a relatively large spot with a relatively fast repetition rate, which is important when you're doing, for example, a neck or a chest or an arm. The applicator is very light. It has a low-pressure xenon applicator. That's the flash lamp. And the handpiece is light enough where it feels about like a laser. You're not holding on to this 3-pound monstrosity. It's very easy to navigate, very easy to hold. Now, look at the spectrum. So most IPLs are unfortunate in the sense that they have their output largely compromised in this wavelength range from 500 to about 800 nanometers. And that's really where you want most of your light, because particularly for blood vessels, you really need that peak, as I said, around 540 nanometers and around 570 nanometers. So Lumecca, particularly the 5D filter, puts out a great part of the spectrum in this area here around green-yellow light. And green-yellow light is really what is important for pigment and vessel reduction, but particularly vessel reduction, and particularly with good cooling. So has a very high peak power, a large spot. The cooling is very, very, very impressive. If you feel this device, particularly when you put it in strong cooling mode, you'll feel almost an ice cold like cooling on your finger. And that cooling is maintained. It doesn't warm up much as you go across the skin. High pulse repetition rate at all settings. In other words, some IPLs, when you go to higher settings, you have to reduce the repetition rate. This has high pulse repetition rate across the full breadth of settings. Easy to maneuver again, and it has this left-shifted photon spectrum. When I say left-shifted, I mean, going to this last slide, we're shifting that spectrum over to the left, to this direction versus this direction. This is really wasted energy out here. This is the energy you really want. This is the energy that is important to establish those good, reliable endpoints as far as vessel closure, which are either vessel stenosis or closure or permanent bluing of the vessel after the intense pulse light pulse. So the things we're really focusing on with the Lumecca device are epidermal pigmented lesions and vessels in the skin. That's the two main targets. And red and brown spots are really what define many people as far as their age, not so much wrinkles. There was a study done not long ago by a plastic surgeon, and they found that most people gauge people's age not so much by wrinkles as they did by color inhomogeneities. And that's why people, when they have a really good intense pulse light treatment, look good. People know they look better. They think everything looks better, even though it might just be their pigment and blood vessels. And again, this is what the handpiece looks like, very easy to hold. This is the applicator where you attach your finger to make it function. This is actually the sapphire window that's cold and attached to the skin or put against the skin. So what are the parameters that are particular parameters for treating different patients? Well, these are go-bys, and clearly go-bys are always important, but these are go-bys, and they're only relevant if you have a good understanding of what skin type you're treating, what pigment you're treating, et cetera. So if you look at a pigmented lesion in light skin, for example, you can choose settings like this with the 515 filter, with short mode. As you go to darker skin, you'll see we switch to the 580 filter, and we go to longer pulses. And we go to longer pulses and longer filtering, we're able to treat vessels and pigmented lesions in dark skin. And we use the 515 filter primarily for vessels in lighter skin. You can use the 580 filter for darker skin, but ideally you would only do that if somebody was tan. So the Lumecca pricing, again, you can choose what you charge to treat patients in the clinic, and that would depend largely on who does the treatment, how thorough the treatments are, and the surface area. But certainly you can make the pricing very competitive to quickly pay off the device, and you can combine it with the other formidable accessories with the device. Again, this device is not just a one-trick pony. It has a radiofrequency needle device called Fractora. It has a gentle heating device, radiofrequency, called Forma. You can combine it with injectables, and you can also do, for example, hair reduction and skin tightening or body tightening with it as well, with the other accessories that are available on the device. Here's some of my own patients again. This is a patient who has some large telangiectasias. This is what the patient looks like right after treatment. You have this redness, but you see the discrete telangiectasias are gone pretty much, and that's what I use all the time with my patients. So the pulse duration is linked to the fluence, and like most devices, as you go to a higher fluence, it takes a bit longer for the xenon flash lamp to develop that fluence. So, for example, in short mode, at 15 joules per centimeter squared, you're at 5 milliseconds. And you go to long mode, you're a little bit longer, about another 20 or 30% longer. So you're putting in more of the energy in a shorter pulse with the short pulse duration mode, and you put it in a bit longer in long pulse duration mode. The long pulse duration mode is less likely to cause PERPA. more likely to spare the epidermis. The short pulse mode is more likely to effectively treat vessels and more likely to be able to be used in lighter skin without any problems. So again, you choose your combination of pulse duration and wavelength based on the application, particularly within the context of the skin pigmentation. Darker skin, you're almost always going to want to use the 580 nanometer handpiece. Shorter pulses do cause purpura, so you go to longer pulses to reduce purpura. Here are some of the parameters again. For superficial small lesions, you tend to use the short filter with somewhat less aggressive settings. You can, with darker skin, then use the longer filter, and you may have to go a little higher than this to get good results. So again, lighter skin, use 515, darker skin, 580 nanometers. And then for medium and large vessels, you can go to slightly higher fluences and use a longer wavelength. Here's some patients again. This is pigment on the cheeks. You see it's markedly reduced after one treatment with the Lumecca 515 nanometer filter. Again, on the left side, you see the pigment's reduced. Also a skin brightening effect and also a somewhat tightening effect, which you get with IPL. I mean, people say intense pulse light doesn't do much for skin tone and texture, but it really does, because in removing these pigmented lesions, there's also a nice brightening of the skin. I don't call it whitening of the skin, but brightening of the skin, and it creates a higher albedo, which is the skin reflectance. It makes the skin look more youthful. There's a close-up. Now, it's very hard to pick off this type of lesion. This is a low-contrast lesion. You may have to go a little higher with a second treatment for that type of lesion. Again, she's better here, and again, you see this is better here. You can do pigmented lesions on the arms. This is before and after, very nice results. Again, the lighter the lesion, the harder it is to treat. Patients don't oftentimes understand that. I always tell them that the lighter your skin is and the darker the spot is, the better it does. Of course, that plays into Mother Nature, too, because the lesions that are the most noticeable are also the darkest. So I tell patients we naturally pick off the low-hanging fruit. And if you do multiple treatments, you can go to slightly higher fluences with each serial session. Presumably, you're telling the patient also to use long-sleeve shirts and be very careful in the sun to get this high contrast between the pigmented lesion and the background skin. See, this pigmented lesion did quite well here, and a nice brightening effect on the arms. Another from courtesy of Dr. Willis in the United Kingdom, again, brown spots 4 weeks after one treatment using the 12-joule setting, short, strong, 2 passes. I normally just make 1 pass. If I see a resistant lesion that hasn't darkened up, I may increase the fluence and do a second pass, particularly in lighter skin or a lighter lesion. Again, vascular results after 1 treatment, and then after 3 treatments here. And again, this is bruising. You can actually treat bruising with the device if you need to. Here's a vessel that did very well with a long filter and longer pulse and high fluence.
We have a few questions. How are you able to achieve results in 1 to 2 treatments with Lumecca as opposed to other IPL devices on the market?
Well, I've had an experience with lots of intense pulse light devices over the last 10 or 12 years, and from various manufacturers. And what I found is that the critical component, again, is the ability to go to a high peak power and to use adequate cooling, particularly to be able to achieve significant vessel reduction. And that's the big drawback to lots of intense pulse light devices. The ones that are underpowered, typically what happens is you can pick off the pigment, but you don't pick off the vessels. So I found, for example, the Lumecca device, even with 1 treatment, and particularly in 2 treatments, I can achieve results sometimes I couldn't achieve with maybe 3 to 4 treatments with less powerful devices.
Have you seen a patient increase since you have started using Lumecca?
Well, the patients like Lumecca because it's relatively comfortable, it's very predictable, and it's reliable as far as removing pigment in blood vessels. And I think one of the main reasons it increases patient demand is because, again, you can combine it with other parts of the device, too. So you have this Lumecca device, which is a great IPL in itself. If you just bought it for the IPL, you'd have a nice device. But particularly when you look at it in terms of the other parts of the device that are available to your patients, you'll see an increased demand.
Why is the left-shifted photon spectrum so important, and how is it different than other IPL devices?
So it gets back again to peak power. Most manufacturers of intense pulse light devices, they make some compromises and concessions, which they have to do sometimes from a manufacturing standpoint, because it turns out that the xenon flash lamp will oftentimes burn out faster if you use shorter pulses and stronger pulses and shift the spectrum to the left. And the reason is it just tends to be the nature of the lamp. And what Lumecca's done, because of the expertise of their engineers who have worked with IPLs for as long as anybody else, they've managed to be able to maintain the durability of the light source, the unique electrical pulsing of the system, and still maintain the high peak power and left spectrum shifting. So by shifting that spectrum to the left, you're able to, again, combine the 540 nanometer peak, which is a green light peak, and the 577 nanometer peak, which is a yellow light peak, which really is the KTP laser and the pulse dye laser all in one, into one powerful pulse to treat vessels. And I think that's what really differentiates this device from some of the other intense pulse light devices on the market, and still have a durable device where the device can go pulse after pulse after pulse for hundreds of thousands of pulses before replacement.
Great. Thank you so much, Dr. Ross. And if anyone has any questions, you can relay them to inmodemd.com.